Thank you, Mr. Speaker. I know in part of the health plan that was released not too long ago, there was a lot of discussion in that health plan in relation to mental health and virtual care. And virtual care in the province, really over the last several years, has been receiving a lot of positive feedback from patients and doctors alike. And we saw during the first start of COVID that virtual care played a major role in accessing health care in the first few months of the pandemic. However, there was some changing, from what we understand, in the billing that doctors were able to bill the province in relation to visits to virtual care, and that billing started to, there was a gap between virtual care and in-person care, and as a result, a lot of physicians wouldn't sign up for virtual care. So I know virtual care is part of the health plan, and I guess my question today is for the Minister of Health. Can the minister tell us if the pay for virtual care will be at least close enough to in-person care to show that doctors will participate in that program?
The Minister of Health.
Well, I appreciate the question today, Mr. Speaker, and I guess here's what I can say to that. The New Brunswick Medical Society and the RHAs and the Department of Health negotiate through a contract. And so those billings are all duly negotiated at every contract. And if something arises, as with COVID, I mean, COVID was a tremendous opportunity. In New Brunswick, we were probably at 1% for virtual visits before COVID hit. And now we have expanded that so tremendously, and it has been a very, very effective way for physicians to keep in touch with their patients. Are they close? I don't know today at this moment what those differences are, but I do know that it's all negotiated through the New Brunswick Medical Society, and so I think that if physicians need to have a consult on that, they really need to do it with their lobbying party.